Good morning. My name is Judd Lam and I'm the Manager of Policy and Research at Carers New South Wales, the peak non-government organisation for people in New South Wales who care for a family member or friend living with disability, mental illness, drug or alcohol dependency, chronic condition or terminal illness, or who is frail aged. I'm presenting this poster today, which you should now be able to see on your screen, on behalf of myself and my colleague, Dr. Hofstaetter, and also my former colleague, Dr. Triandafilidis, and I particularly wish to acknowledge both of their extensive work on the survey data that I'm going to present today. Before I take you through this poster, it's very important that I take a moment to acknowledge Aboriginal and Torres Strait Islander carers, and indeed all Aboriginal and Torres Strait Islander people. In particular, I wish to acknowledge the traditional custodians of the land that I'm presenting from today, which is the Gorogal people of the Eora Nation, and their elders past, present and emerging. But I also wish to extend that acknowledgement to the traditional custodians of the many lands that you as the audience will be watching from today. This poster outlines key findings from the Carers New South Wales 2018 Carer Survey regarding the mental health and wellbeing of Aboriginal and Torres Strait Islander carers in New South Wales, in particular those living in non-metropolitan areas. And it's based on 50 responses to our 2018 survey from that group in New South Wales. It's important to note, as it notes in the introduction of this poster, that Aboriginal and Torres Strait Islander Australians are around twice as likely as other Australians to have an informal caring role in the life of a relative, friend, or other member of the community. While caring for friends and family members tends to be perceived in these communities as both a duty and a privilege, research also shows that caring can involve a lot of challenges which can exacerbate the socioeconomic disadvantage experienced by many Aboriginal and Torres Strait Islander Australians. If I just scroll down here and you can take a look at the bottom left-hand corner of the poster, you can see some facts and figures here about the 50 Aboriginal and Torres Strait Islander carers that responded to our survey in 2018. Most of those respondents were older females who had been caring for well over a decade. Nearly half were caring for more than one person, and the vast majority were caring for someone with essentially 24-hour support needs. These carers were caring for nearly 100 hours per week, which if you think about it is well over twice as many hours as a full-time paid job. As I scroll up now, bear with me, it's a little challenging presenting a poster online in this format. At the top right-hand corner of the poster there, you will see the heading Key Wellbeing Challenges. So this really demonstrates, I think, even further the intensive caring role of our 50 Aboriginal and Torres Strait Islander respondents and the impacts on their health and wellbeing. As you can see there, many of those respondents have a disability themselves, and that's actually at a much higher rate than the general population of carers. Nearly half of those respondents had no other informal support that they could call on in providing care, and most of the respondents experienced high levels of emotional distress and found it difficult to make ends meet. They were also less likely than other types of carers to access carer support services that can prevent and help address those health and wellbeing outcomes. Scrolling down again, you can see there in table 2 that we have split up the respondents, the Aboriginal and Torres Strait Islander carer respondents by region. Regions here are based on primary health network regions, and as you can see, around a third of those Aboriginal and Torres Strait Islander carer respondents were from areas that we've classed as non-metropolitan regions, which means primary health network regions that did not contain one of the major cities of Sydney, Newcastle or Wollongong. In the middle of that table, you'll see Newcastle and Wollongong regions, which basically refers to the Hunter New England and southeastern New South Wales primary health networks, primary health network regions, which do include Newcastle and Wollongong, but also include some regional and rural areas. So really, the majority of our Aboriginal and Torres Strait Islander carer respondents were in areas that could be classed as regional, rural or remote. And that hopefully gives some context to the health and wellbeing results that I presented previously. Moving on to remoteness and mental health, which is really the topic of today's conference. We asked our respondents, the majority of whom were in those regional, rural and remote areas, how caring had impacted their own physical and mental health. 21 of the Aboriginal and Torres Strait Islander carer respondents had some kind of long-term health condition, mental health condition or disability, and a number of those specified a mental health situation that they were experiencing that was linked to their caring role. And so you will see there a couple of quotes on this topic from Aboriginal and Torres Strait Islander respondents, just a couple that I've chosen there to illustrate the way in which caring can impact self-care of carers, and then subsequently well-being, both in the physical health sense and the mental health sense. And really the majority of the respondents that had indicated that they had a pre-existing condition also said that caring did contribute to that condition. To conclude, this poster highlights the importance of carer support services and other service systems being more inclusive of and culturally appropriate for Aboriginal and Torres Strait Islander carers to ensure that there is timely support, appropriate outreach, and to try and start addressing some of these compound disadvantage factors that Aboriginal and Torres Strait Islander carers experience. Thank you for your time, and I hope you enjoyed this poster presentation.